I have just tabled this committee report on medicinal cannabis and industrial hemp in the Parliament of Western Australia. There are 16 recommendations for the government to consider. Let me walk you through them. Recommendation 1 covers real-time prescription monitoring. Now that we have this technology in Western Australia, there is no need for the current requirement for healthcare professionals to be authorised to prescribe or supply cannabis-based Schedule 8 products for adult, non-dependent patients. This will save everyone so much time. It will reduce barriers for healthcare professionals and significantly improve patient access. Recommendation 2 covers interstate prescribers. The Department of Health should amend the Schedule 8 Medicines Prescribing Code, allowing prescriptions for Schedule 8 medicinal cannabis products written by interstate prescribers in Western Australia, as long as they meet all legal requirements. This will streamline access to medicinal cannabis for patients that are financially or geographically challenged. Recommendations 3 and 4 cover THC limits. Now, it's recommended that the Department of Health revise the daily THC prescribing limit from 40 milligrams to at least 100 milligrams and review the necessity of a daily prescribed limit at all. Do we need one? This will bring WA into line with the other states and provide patients access to medicinal cannabis without unnecessary and arbitrary restrictions. Recommendations 5 and 6 cover education and advisory services, suggesting the Department of Health investigate the feasibility of a medicinal cannabis advisory service. Why? To provide guidance and support for healthcare professionals in the field, as well as printed and online resources for patients, families, friends, and employers about the legality and therapeutic benefits of medicinal cannabis and promoting its proper use and acceptance in society. Recommendation 7 covers a compassionate access scheme. The WA government should conduct a cost-benefit analysis and implement a compassionate access scheme for medicinal cannabis products, providing affordable access for patients in need and promoting health equality and social justice. Almost every medicinal cannabis patient I speak to has issues with the price of their medication, and until we can get cannabis listed on the PBS, this measure will help to ease both financial and physical pain for many. Recommendation 8 covers THC driving. We should amend WA traffic laws to introduce a defence for patients driving with medicinal cannabis. The presence of THC does not correlate with impairment. We should not be unfairly penalised when driving with THC. Driving when impaired for whatever reason should not be permitted. There's an obvious flaw in our legislation that other states are addressing, and WA needs to do the same as a matter of urgency. Recommendations 9 and 10 cover workplace and employer guidance. The Department of Mines, Industry Regulation and Safety should review and update its publication on alcohol and other drugs in the workplace, providing more comprehensive and contemporary guidance, and should develop resources for employers to better understand the differences between medicinal and recreational cannabis, addressing misconceptions and ensuring that patients are treated fairly in their workplace. Recommendation 11 covers rail safety. The WA government should amend the Rail Safety National Law Act to differentiate between legal and illicit use of cannabis, providing clarity and fairness for those using medicinal cannabis legally, whilst ensuring that they are not unjustly penalised. Recommendations 12 and 13 cover GP surveys and research. The government in WA should implement an ongoing anonymous survey of GPs to gather data that informs future clinical studies on medicinal cannabis and support research into medicinal cannabis with higher education, health and industry sectors, driving advances, improving the evidence base and facilitating patient access. This will allow us to collect data that can drive further knowledge of the medicine. Recommendations 14 to 16 cover industrial hemp. DPIRT should review and evaluate the Industrial Hemp Act, eliminate undue constraints, and amend the Narcotic Drugs Act, remove obstacles to the cultivation and commercial sale of low THC hemp, and also maintain financial support for industry research, spurring innovation and the expansion of environmentally sustainable industries. We have spent 2 years working on this document. It's valuable, it's important, there's a lot of good information in there. We need your help. Reach out to your local MP and ask that this be listened to in government. Let's make it happen. Let's make it happen now.